Hello everybody, my name is Dr. Zafar Masoumi. I'm a radiologist. I'm assistant professor of Yusuf Medical Science University, a university of south of Iran. I have lots of experiences about reporting CT scan, MRI, and X-ray images of some hospitals of south of Iran in the last 16 years. And as you know, final diagnosis of diseases could be based on imaging finding only. For example, pneumothorax could be detected by X-ray or CT scan. Also, other ways to get final diagnosis are pathologic sampling. As you know, in the most disease, this way is the best way, and sometimes only clinical findings could be the final way to diagnose the disease of the patient, such as IBS. And in some conditions, combination of these methods is helpful to get final diagnosis. First, at first, I dedicated this beautiful tulip flower, inverted tulip flower, to you to join me, and without further ado, I'm starting to show you the first case. Yeah, the patient was referred to the hospital due to abdominal distension and vomiting. And this CT scan was obtained from the patient after administration of oral and IV contrast, and these axial images are shown here. As you know, kidneys appear normal, aorta and periaortic region appear normal, and some bowel loops are fluid filled and may be dilated. The next slide demonstrated more dilation of small bowel loops, predominantly filled with fluid and somewhat with gas. And as you know, dilation of small bowel loops is indicated when the diameter of the dilated bowel loops is more than 3 centimeter. And if we size from here to here, from one side to other side of the dilated bowel loop, it's more than 3 centimeter considering this scale beside the image. Pattern of the dilated bowel loops is a clue to obtain better or final diagnosis here. In the next image, you also could find dilation of bowel loops without wall thickening, except for a change here which show slight increased diameter. And in the next image, the focal point of narrowing of small bowel loop is here, which has a transition zone between two points of the bowel loop. And in coronal view, may be better to detect this transition zone. Here is another axial image, and here is focal point of obstruction. Yeah, the diagnosis is obstruction, okay? But it's important to say what type of obstruction is occurred. What type of obstruction should be reported? Yeah, as you guess, closed loop obstruction is the final diagnosis. In this surgically proved case, the adhesion of the site of obstruction was the cause of obstruction, of closed loop obstruction. You noticed I said you arrangement of the bowel loops of dilated bowel loops are in the periphery of the abdominal cavity and forming and mimicking a C or U shape here. So it's important as a clue to obtain closed loop abstraction, because in the closed loop abstraction bubble loops are arranged as U or C shape in the periphery of the abdominal cavity. And it's important to report closed loop abstraction because this type of abstraction is slightly dangerous than other types due to risk of perforation and the necrosis of the bowel loops. The next case also presented here by abdominal CT image with IV and oral contrast, and here also some distension of the bowel loops. But what types of bowel loops are distended? As you know, large bowel obstruction is demonstrated here, and more than 6 centimeters in diameter of the large bowel is indicated as distension of the large bowel, which is at risk of perforation. So here is distension of the bowel loops as U shape, and here is transverse colon, which is significantly distended and filled with gas and mixed gas and fecal material. And on axial images, here in the circle you can see point of obstruction in the splenic flexure, which show by irregular thickening of the bilateral side of the splenic flexure. And here in the coronal view you could see it better than axial images. Specific point of obstruction is shown here, and the cause of this obstruction is colon cancer. But colon cancer is more common in sigmoid colon than other parts. But here, after surgical exploration and pathologic sampling, diagnosis was confirmed as colon cancer. And another topic about closed loop obstruction I forgot to mention is closed loop obstruction could be produced by adhesions or by herniation, and some types of closed loop obstruction in the large bowel may be or could be the same picture but named as valvulus, such as sigmoid or cecal valvulus. And here I stopped my slices, my presentation as a first presentation. I hope you forgive me for my mistakes in pronunciation or in vocabulary or using fillers and interjections during my speaking, but be sure that these specific diagnoses are correct. So wait for the next video of my specific and slices and my experiences. So long, bye.